Madam President.
The senator from Missouri.
We suspend the quorum call.
Without objection.
Madam President, I want to talk a little bit about the letters I've received and the emails and the calls over the last few days about the health care plan. The numbers signed up, or whether the website worked or not, I've never thought and have said repeatedly, aren't really the test here. The test is this a better plan? Does it allow more people to have better coverage, or does it allow actually more people to have lesser coverage, which I'm becoming more and more convinced that might be the case. The high deductibles, the increase in premiums, the benefit of a couple of years actually where the trajectory of health care costs was beginning, still going up, but beginning to flatten out. Now it's projected to go up pretty dramatically over the next few years in the recent projections. But the real test here is this a plan that's a better plan? Not does the website work? I mean, the fact that the website doesn't work just sort of shows the ineptitude of government. The easiest thing to do in the world today should have been in 4 years to figure out how to develop a website. So I always said the website shouldn't be the test of whether the health care plan works or not, because the website will work. Apparently a number of states are having a problem. The federal government had a very obvious problem, but the website will eventually work. Surely that can't be a long-term problem. And given no other alternatives, people are going to eventually sign up in some number. And I'm not even interested in fighting whether the number's real or not. I did notice that the president, like most of the people I work for, in his announcing the numbers the other day, referred to the plan as ObamaCare again. I noticed he'd quit doing that since the election. He said he kind of liked ObamaCare in one of the debates, the presidential debates in 2012. He liked the term, and he pretty well quit using it. But with the sign-up numbers, he said some people call it ObamaCare in his announcement the other day. So I guess if he can call it that, people I work for can call it that as well. But premiums rising, deductibles going up, hospitals seeing in many cases, their fastest growing column of unpaid debt is people with insurance. Now, not too long ago, we just said, well, that doesn't make any sense. How do people with insurance wind up in the fastest growing column of unpaid debt? It's because people's deductibles are, for many families now, well beyond a deductible they can pay. And if you had a $500 deductible a few years ago and you have a $3,000 deductible today, if you had a hospital bill, you might be able to put $500 together and think that just gets this bill paid. Nobody's going to call me anymore. I'm not going to get this repeated notice. But if you have a $3,000 deductible, you might just decide, I can never pay that, so I'm just going to let them do whatever they're going to have to do. And hopefully my insurance company pays enough of the bill that the hospital decides that they're going to not bother me. But that's the fastest growing debt in many hospital accounting offices right now, are people who have insurance who aren't paying their part of the bill. But whether it's increases in premium or increases in deductible or can't see their doctor, the people I work for in Missouri tell me every week a series of stories that I absolutely believe are true. At least we verified with them before I come to the floor with this, pulling a few of these stories out. Do you mind, Timothy from Kirksville, if I mention that you've contacted us? I'm not going to give your last name or put that on the record, but I would like to show that there's some dispersing around our state of this problem. And they say, yeah, this is absolutely true. And I told you because I want people to know about this. Timothy from Kirksville said that his premiums went up drastically in 2013. If premiums continue to rise, he says his family will have to make sacrifices elsewhere in their budget. Kim from Frankfort, Missouri, said she and her husband's deductible recently increased dramatically to $6,000. So far, she says it feels like we don't have insurance because we have such a high deductible. We couldn't pay it if we ever had to use it. So do you really have insurance? Kim's parents recently tried to find a plan on the exchange and were shocked to learn that the cheapest plan they could find offered premiums of $1,200 a month with a $12,000 deductible. The yearly premiums were equal to 20% increase, or equal to 20% of their income. Our Mike from Columbia said his health insurance premiums shot up by $1,000 this year, and $1,000 matters to families. And based on the letters I get, there'd be some temptation to contact Mike and say, well, if you want to look at the whole stack of letters here, $1,000 is really not the worst story people have to tell, but for a working family, it's almost $100 a month. It's whatever you were going to do with that $100 a month that you're not able to do because your insurance just went up $100 a month. And Mike doesn't say anything about his deductible or what his premiums are, but he just says it's $1,000 more than it was last year. Lisa from Jefferson City, Missouri, the state capital, said that she and her husband own a small business, and even though they don't have to provide health insurance for their employees, they have done so, and they've chosen to pay 100% of the cost up till now. Now, actually, until January of this year, no employer had to provide insurance for their employees, but most employers did. 85% of everybody that had insurance got insurance at work. 90% of them thought what they had at work was great for what they needed to have for them or their family. We had a system that was working pretty good for almost everybody that had it. Instead of figuring out how to expand that system so other people could get in, I'm afraid we've made it more difficult for everybody involved. Lisa, the business owner, says that their premiums went up 35% last year. And they've been told already that they'll go up even higher next year. She says if the premiums continue to increase, they'll soon not be able to cover their employees. Carol from Cameron, Missouri, said that her coverage has gone down, her out-of-pocket costs have increased significantly. Her deductible is now $3,500, and she has to pay $65 every time she goes to see a doctor. She worries that she'll never be able to use the coverage she's paying for because the out-of-pocket costs are too high. And if she ever actually got sick or had to go to the hospital or had a significant condition, she's worried that she can't pay the deductible even though she's paying every month to have this coverage and feels like the coverage is not really insurance for her at all. Merle and his wife at Cape Girardeau are in their late 60s. They have Medicare and a supplemental policy, but their co-pays have increased, and one of their primary doctors has stopped taking Medicare, and he and his wife are concerned that they can't see the doctor they'd like to see, that their co-pays have increased, their doctor left the program, and by the way, the administration, I guess the day before yesterday, announced that we weren't going to have the reductions in Medicare Advantage next year like we had this year. Still have this year's increase, but you won't have next year's increase. Whoever thought that paying for a new health program out of Medicare was a good idea anyway? $500 billion out of Medicare, which was has bigger and bigger problems all the time as more and more people enter Medicare. $500 billion out of Medicare to pay for yet another new system. And apparently even the administration, at least between now and the election, doesn't think that's a good idea because they just suspended one of the pay-fors. Say, well, we did that once, and that was kind of painful because people could see what was going to happen to their Medicare Advantage. So we don't want to do that between now and Election Day, though I think in fairness, they didn't mention Election Day in the rule. They just mentioned that it wasn't going to happen in this even-numbered year. Mike from Kansas City says his premiums went from $600 a month to $700 a month for he and his wife. And his deductible went from $5,000 to $7,500. He says all because of the new requirements and what has to be covered. Mark from Columbia says that the doctor he's had for 18 years joined a network of concierge doctors because he's afraid of the president's health care plan limiting his ability to provide quality care to his patients. Unfortunately, now that his doctor is part of a private network, Mark's no longer able to afford him or to afford to see him and not covered by the insurance that Mark is covered by. All kinds of unintended consequences appear to be happening here when the government decides that not only can it begin to involve itself in 17% of the economy of the country, but in virtually everybody's healthcare decision-making process. This would be a big job for a really efficient government in a really small country. In a federalist system where you have 50 states and territories to deal with, and a big country, this is really hard to do, and it's unfortunate that all of the warnings about the unintended consequences about people at the workplace that would begin to have part-time jobs instead of full-time jobs, or people that had less than 50 employees that wouldn't want to go to 51 because they'd then be covered by a law they're not initially covered by. All of those warnings have turned out to be at least as bad as those people saying this could happen were saying they could be. John in Moberly, Missouri, went to healthcare.gov to find a plan. The cheapest quote he could find for his family of four was $750 a month. And in John's case, that's almost 30% of his income. He's looked at the numbers and decided it would be more affordable to go uninsured. He said, "I'm self-employed, married, and have 2 children, and though I'm self-employed, I never had any problem affording health insurance for me and my family until now." Richard at Stoutsville, Missouri, his wife's premium last year was $359 a month with a $5,000 deductible. This year it's $800 a month, and since they're on a fixed income, they've just decided they can no longer afford to pay for her individual insurance because they had to buy it as individuals. I would just say that we need to look at these cases. Surely somebody out there has benefited from the system. The people that were able to stay on their family policies longer, and a piece of legislation I wrote when I was a member of the House, it was three and a quarter pages long. Apparently it's added about as many people as any other single thing did, and it would have added those people whether you had the rest of this health care bill or not, at no cost to any taxpayer anywhere, and at no disruption of anybody else's insurance coverage. Those are the kinds of things we should have looked at, but we need to look at what it takes now to be sure that we have a system that's not measured by whether the website works and not measured by an argument about whether people who signed up paid or not, but is measured by whether or not this really does provide better health care. Health care is critical to families. Somebody told me one time that when everybody in your family is well, you've got lots of problems. When somebody in your family is sick, you've got one problem. That's how important health care is, and we need to be sure that this is a system that doesn't meet some numerical or technical check the box, but really does provide access to what was the greatest healthcare system in the world, and there were ways to encourage more access to that system and more choices, not fewer choices, and less access, and more people who feel like they're paying a premium every month, but if they ever really get sick, they really don't have insurance. And I would yield the floor and suggest there's not a quorum here.